in this session and continue asking questions. We'll continue answering them. So, Karibu Polycarp.
Thank you so much, Shamim.
How are you this morning?
I'm very well.
Yes,
I'm
excited
ready.
for the holiday tomorrow?
Absolutely.
Mazingira Day.
Absolutely.
Okay, so can you, as for the benefit of our audience as well, tell us a bit about yourself? And you're the Director of Administration in the Department of Health. What does that mean? What does your role look like? What's your day-to-day? What does your work involve?
Thank you so much, Shamim. As you said, my name is Polycarp Opio, currently Director in charge of Administration, Support Services, and Partners Coordination. I performed the role for, I've been in this county from inception 2013 to the current position where I am, and I'm glad to serve the people of Vihiga County in various capacities that I've held. My role is to coordinate support services in the Department of Health, largely to ensure that what our technical staff need to perform are available to the best of our ability as a county. We coordinate also what the client experience in our facilities in terms of getting the services they want. I also do the partners coordination. We engage various partners, support them to the point where we have an MOU for them to support various health intervention in our county. Yes, that is my role.
Okay.
Thank you.
And thank you for, you've mentioned some of the things we'll be discussing today. So one of the things you've mentioned, you deal with partner coordination. And over the last couple of months and years, we've seen that there are a lot of MOUs that are usually signed. And I can highlight some of the recent ones we've had. So we've had Global Telehealth Network, who are supposed to help us leverage digital health technologies, Mission for Essential Drugs and Supplies, to ensure health facilities have a leeway to constantly access drugs and medical equipment, among others.
Sure.
And so what's the role of such partnerships in advancing health outcomes in Vihiga? Because now we talk a lot about universal health coverage. So how do these partners come in? How do they help? And when we have an MOU, for instance, when do residents get to see the impact? Like now that we've signed one, at what point or how long or how well do the services get done, and then we can see from now the community level the impact.
Thank you. I want to say that partners play a very crucial role in service delivery in our county, not just Vihiga County, but all the 47 counties and even at the national level. So I want to thank our governor for adopting an open door policy for our partners. Not all counties get the kind of partners that we get, but because of the environment that has been created. Number two, answering your question, the resources we have as a nation, the resources we have as a county is not adequate to provide the kind of services that is expected from our people. Therefore, the partners play a very important role in bridging some of the gaps in service delivery. I'll give an example like our entire intervention of HIV/AIDS, mother and child health, nutrition are supported by partner. So they play a very important role in supporting service delivery. Number two is also on the technology transfer. Health sector is evolving very fast. There are technologies that are coming out every day. There are technologies that are getting redundant, so you have to continuously acquire new technology. Some of these partners help us with the technology, like the telemedicine network you've talked about. They are coming to help us adopt the telemedicine where we do not have to have a doctor in Vihiga County to help us diagnose and treat a patient. We can access a doctor from every part of the world. They'll be able to coordinate with our doctors and provide solutions that would have otherwise meant that we refer the client to seek services other places. So that is one of the things. Number two, they also help in training our staff. I've talked about health is very dynamic. There are a lot of changes going on every day. The WHO is giving us guidelines every day. So we have to keep on building capacity of our healthcare workers so that they're able to offer services based on the modern technologies and the guidelines. Okay. So partners are important.
And at what point do you now, as residents, do we see this impact from now the different partnerships? Because apart from the ones we've mentioned, there are several others that have been going on for the last couple of years. So when do I get to see, you know, the impact at the community level, at the facility? How does that now translate to
Our
that?
clients, our people get to benefit from this partnership. Sometimes we have not been very good at explaining. But I'll give you an example. Today, anybody who is walking into our CCCs in any facility, you are likely to find a staff that has been employed by a partner. When you get the drugs, that drug has been supported and procured through the support of a partner. Recently, we had a partner, that is the Alliance for Africa, Rainbow Alliance for Africa. They donated for us some equipment, the portable ultrasound machines. Largely, we do not have adequate ultrasound machines in our facilities. So they did a donation. And the most important bit of it is that these donations, this equipment are now, we are capable to take them to the villages and do diagnosis in the villages, like very important in management of pregnancies, so that we're able to tell the mothers the status of the baby, what they need to do, and also to identify any sign of danger and advise appropriately. So the technology is important in ensuring that we improve service delivery to our people. So my point is that some of the benefits our people are already enjoying. The only thing that we may not be able to explain that what you are enjoying today is a support from a partner. When you go to our facilities, we have equipment donated to us by partners. But by the time our clients are using those facilities, equipment, we do not tell them this equipment was brought by this partner. I think that is a point I want to say. But the point, the training is going on. When you go to a facility, the client is able to offer you services based on the current technology, based on the current guidelines. Somebody supported the training of that staff.
Okay.
Thank you.
Okay. I think, yeah, it's also important for us to understand that, because we rarely see it labeled, this was supported by this partner, or that when I go to hospital, I rarely think that, you know, this staff was maybe trained by this partner to use this equipment. So I think it's important, yeah, and thank you for that, because now we kind of understand the importance of partners, especially as we, you know, health is important.
Sure.
If you get sick today, everything stops. So thank you for that. And then also another partner that we've been working with is TISA, and they recently released 2 reports for the department. So there's the Community Scorecard Report on Health and a Citizen Shadow Report on the Vihiga Hospital Plaza. And one of the recommendations from the Community Scorecard Report was to institutionalize the Community Scorecard process and enhance citizen engagement and communication. So I just wanted to know, how does the department incorporate public feedback or community participation? Because we usually see a lot of people raising concerns, especially on social media, when an equipment is not working. So how do we incorporate this feedback? And is this community scorecard process being done in the department, or how feasible is this?
Thank you so much, Shamim. I want to confirm that we had prior engagement with TISA when they were sensitizing our staff. We had an opportunity to go through the tool that they were going to use to collect data. And as a department, we welcome the report because it has pointed some gaps that even though we are aware they exist, but I think adding their voice was important because this is the voice of the people. Community scorecard is a very powerful tool because it gives the community an opportunity to give feedback on the services that they get based on the taxes they give and the commitment of the county government. So they called us for a meeting, we read the report, and we aligned to some of the content of the report. One of the issues they raised was a shortage of staff, which we really appreciate. In Vihiga County, we need a total of 2,400 healthcare workers. Currently, we have 1,107. So there is a gap in terms of the numbers. There's also a gap in terms of the skills. I want to thank the county government because we have been consistently making recruitment. The challenge would be having adequate resources to bridge the gap at once. I've been here from devolution. At devolution, we had only 640 staff. That is in 2013. The number has since almost doubled. But of course, the demand for services has also gone up. So as you continue to add the staff, there is also the challenge of you expanding the range of services. We currently offer services that we are not offering earlier on. So we agree that there is a gap in terms of staffing. The other issue they raised about the staff is the performance and the output, the productivity of our staff. And we have agreed that there are things we are going to work on in terms of ensuring that the staff are available as required by law, based on their individual contracts. We are going to ensure that we monitor their performance and get the feedback issue about the hospital plaza, which we agree between the contractor and the county. And sometimes when there's a court process, so there are issues that are largely beyond the county government. When it is referred to court, it takes a bit of time. But His Excellency, the governor has committed that the project will be ready by the end of this year. And I would want to invite the people of Vihiga County. This is your project. These are your taxes. Please just walk into County Referral Hospital and tell the management, I want to see the status of this project. Don't wait for somebody to make a post. You have that liberty as a citizen of Vihiga so that you're able to appreciate what is going on. Currently, the project is undergoing finishing. The county has even installed lifts, so it's just a minor finishing that is going on, and then we'll be ready to utilize. Okay. But we appreciate the report. Yes. Though they talked about the level of completion, they're talking about 50, but I think it is almost 95%.
Okay.
Thank you.
Okay. And also just to add on that, the Deputy Governor was also part of that engagement, and he mentioned that by mid-2026, the administration would ensure that the hospital plaza is complete. So we'll also be looking forward to seeing that.
Yeah, that was in the essence of also equipping. There's a structure, but there is also the equipping. So we will start utilizing on a phased approach.
Okay.
Equipping the entire facility will require a lot of resources. But we're already working on getting the resources to start utilization. There are services that we will transfer immediately the structure is complete. Like theaters, we already have some equipment, the ICU and the rest. So, but it would be phased approach. So I think his timing was very realistic in terms of getting all the equipment that is required.
Okay.
Thank you.
Okay. And thank you for also explaining that, because you know, when we talk about next year, we feel like it's a really long time, but when we think about, we only think about the house building, when we're building, and then we forget we need chairs, we need, you know, beds equipment. In the house. So
some of them are pretty
hospital,
expensive.
We also we need equipment. Yeah. We need the machines to work. We also need you know, for staff, places to sit. Sure. and work. Sure. And also now on speaking more on partners. So you've mentioned some of the work that Rainbow for Africa has been doing, and other partners. We've had Canadian Nurses for Africa who donated motorbike ambulances with sidecar platforms. Yes. Just we also had Maziwa Foundation who are promoting infant nutrition, and they're carrying out, they're doing a lot of work in terms of breastfeeding, especially in August we usually have breastfeeding week, so that's also an important venture. And now you also mentioned that there's also capacity building among the staff. Sure. But now when we talk about that, do we also have, you know, these reports, do citizens have access to, you know, when a partner comes in, do they do reports, and can I, you know, find out what was the, you know, what was done by Canadian Nurses for Africa? How does that affect me? Is this usually available to citizens? Is there, you know, knowledge sharing in any way from the support we get from our partners?
Thank you. I think probably starting from the point of MOU, we've also got the feedback from the social media that the county is signing many MOUs.
Yes.
I want to inform the people of Vihiga that the MOU signing is a very rigorous process. The partner must demonstrate the value that that kind of partnership is going to add to service delivery. It takes days, sometimes takes months, but lastly and most importantly, it has to be reviewed by our county legal department so that every MOU is legal and does not go against any established law. So it's not that somebody just walks in today and tomorrow we are signing an MOU. That is not the point. It is a rigorous process. The technical team have to come through every paragraph of those MOUs. So every MOU is intended to improve service delivery. And we have seen tangible benefits to the people of Vihiga. We have partners that have donated equipment that are supporting our people. We have an MOU and partnership with Safaricom Foundation. Currently, they are constructing a all mother and child hospital in the county referral hospital. They will equip it and hand it over when it is ready for use. So what is the problem with such kind of MOU? So we want to tell the people of Vihiga MOU signing process is very rigorous, and we ask a lot of questions. There are people ask for MOUs and they never get to be signed because in the course of discussion you realize they're not going to add any value, or they want to do a technical support in place where you already have technical team. So it's not everybody who walks in will get an MOU. It must meet some threshold. In terms of reporting, and I think the gap that has been there, and I thank you for this opportunity, how we communicate some of these results. In health, every activity is conducted is addressing a specific indicator. For instance, let me talk about immunization. Some of the support are reflected in our indicator of fully immunized child, which Vihiga is currently doing, was ranked to be almost #1. So that's how the results is reflected. But we also have reports that individual partners share with us. We need to find a report where we can make them public, especially through our website, so that our people are able to know the contribution. This is a commitment I think we are going to take as a department. Yes.
Okay. So moving forward, we should see a lot more reports, on our website and also on our other platforms.
Absolutely.
So that people can also, get an opportunity to read them. And now we'll stop asking the question of, what is this partner doing? Because then we'll have the report.
We will preempt the questions
to see
and
what
answer
they
them
have
in
done.
time.
Okay.
Thank you.
And then we also have one of the key sectors in the health system is community health promoters. And Vihiga County was recently recognized as the best county in Kenya in the CHP program by the Ministry of Health. But residents raised the questions that they have not seen their work on the ground, and there are also concerns that they are not paid well. So what can you tell us about the work of CHPs and the importance of their work in the healthcare system?
Community health promoters are a very strong pillar, not just a pillar, but a foundation for healthcare delivery. It is a model that was adopted and is being promoted by the WHO. And that's why the national government actually adopted it, because it uses the community-owned resource persons to tackle health challenges in their community, within their communities. But most importantly, we are using them also to help us change the health-seeking behavior of our people. For instance, sometimes back people used to go and deliver within the traditional birth attendants because they were accessible in the village, but they did not have medical training. So we are using CHPs to change their behavior so that they come and deliver in our hospital. And the figures are very impressive. Most of our mothers deliver in our health facilities, and our children are also getting the vaccines in our facilities. So community health promoters are a very strong foundation for healthcare delivery. And that's why His Excellency the Governor made it a priority when he came into the office and said, we are going to pay them from county resources. Remember, there are counties in this republic that stipends are being paid by partners, but in Vihiga County, a decision was made, and there's never been a turn back, that they are supposed to be paid by the county. Our CHPs are visible on the ground. Today, take a walk in our villages. You are likely to find our CHPs in the villages. So I'm not sure which part of Vihiga somebody would say that I've not seen the CHPs. And we see their work. We have given them digital equipment. They have smartphones. They are able to take data and send it through a platform. So our CHPs are very active, and we see the data. When they were number one, it was because of the data that they sent, the number of households that were visited, their reports, whether they did it in time, how many, that they are given targets, how many houses they visited. So we are very proud of the work that they do, because there are people who ordinarily would come to health facility for problems that can be addressed at the village, like taking a BP. Now we've given them equipment, they're able to take all this. So we are proud of the work they are doing. The national government community health policy was actually largely informed by what was happening. Vihiga started much earlier, before the 2024, when it was actually launched by the president. So we are proud of what they do. And this is a priority to us, because we also get very useful data from their community visitation. In the last KDHS survey, Vihiga was ranked number one in terms of fully immunized child. The success we attribute to the work that the community health promoters are doing. So we have seen improvement in some indicators because of their contribution. So we are proud of them. We continue to improve their working environment. Like Vihiga County, the national government says the CHP are supposed to be paid 5,000 per month, in which the national government contribute 2,500. The county is supposed to pay 2,500 based on that partnership. But Vihiga County is paying them 3,000. So the CHPs in Vihiga are paid 5,500. And I know there's a discussion that we need to adequately compensate our CHPs. These are national discussions. When finally there is a policy, there is a directive to that effect, I believe Vihiga County will be happy to implement based on the support, based on the work that the CHPs are doing in this county.
Okay.
Yes.
Now, as we conclude, do you have any last words, any final message you'd like to share with the people of Vihiga?
I want to thank the people of Vihiga. Trust me, we see your feedback. We see the social media posts, we read them. And sometimes we take action. We may not tell you we've taken action, but we do read them. We understand them, and we relate to some of the issues that are expressed. And we want to encourage them to continue engaging. Health is not for the technical staff. Health is for the people of Vihiga County. The technical staff are your employees. The governor is your employee, and they are supposed to work for you. So we put ourselves in that space that we are ready to engage in a very constructive engagement. We are ready to open so that you are able to see what we are doing, because health is not a mystery. It is a collective responsibility. But also take your responsibility as an individual, as a household. There are things that you can do. There are health interventions like drinking safe water, having toilets in your homesteads, and going to health facilities, let's say for deliveries. That is the responsibility of the citizenry, and we ask them, do your part. we'll try within the limited resources space that we have to do our best. Lastly, we got your feedback when our equipment in county referral hospitals were not working. And I want to confirm, just like His Excellency the Governor promised, that you are doing everything possible within our means to ensure that we have some of this equipment back in service, that today our CT scan has been revived. It has taken a bit of time and also take a bit of resources, but the people of Vihiga County can now enjoy the service at the county referral hospital. We are working around the clock to ensure that our dialysis machines are operational, and we will get there. But continue engaging us. If you can put it out there, we'll be able to read. If you have time, walk, ask and challenge. The offices are open. Go to county referral hospital, engage the medical superintendent. He will be available. So we need to move towards constructive engagement, because when we do that, we are able to improve service delivery to the people of Vihiga County. That is our responsibility. Despite limited challenges, sometimes there are challenges with fund flow from the national government, but we'll try to do our level best, because that is what we expected to do. Thank you very much.
Okay. And thank you to everyone who's been watching us today. Today we've had the Director of Administration from the Department of Health Services, Polycarp Pio, answering our questions. And next week we will have the Vihiga County Referral Hospital Medical Superintendent on this platform answering your questions as well. Thank you to the crew behind the scenes, and we hope to see you again next week on Friday. Thank you for joining us for this special edition on Thursday, and happy Mazingira Day tomorrow.